Imagine stumbling upon a tropical virus right in the bustling suburbs of New York. Sounds like something out of a sci-fi movie, but it's very real. Recently, health authorities in New York announced the state's first case of locally acquired chikungunya virus in 6 years, raising eyebrows and sparking concerns about how such illnesses can sneak into everyday life. This isn't just a headline. It's a reminder that mosquito-borne diseases might be closer to home than we think. But here's where it gets controversial. Could climate change be making these tropical threats more common in unexpected places? Let's dive into the details and unpack what this means for everyone. According to officials from the New York State Department of Health, a resident of Nassau County on Long Island has tested positive for chikungunya, a mosquito-transmitted virus that's been circulating in areas like China and other global hotspots. The case marks the first instance of local transmission within the U.S. since 2019, with the patient noticing symptoms back in August. Intriguingly, the individual had ventured outside their immediate region but stayed within the country, leaving authorities puzzled about the exact source of infection. Health experts believe it was likely a bite from an infected mosquito, yet no traces of the virus have been found in local mosquito populations, and there's no sign of it spreading further at this time. To help beginners understand, chikungunya is a viral infection primarily spread by Aedes mosquitoes, the same type that can carry diseases like dengue or Zika. Unlike some illnesses, it doesn't pass directly from person to person through casual contact. You need that mosquito bite to catch it. These mosquitoes thrive in warmer climates, and interestingly, the species known to transmit chikungunya is already present in parts of the New York City metropolitan area, including areas like suburban Long Island. It's a bit like how certain plants or animals adapt to new environments. Mosquitoes don't respect borders, and with milder winters, they might be sticking around longer. And this is the part most people miss. While the risk feels low right now, especially with cooler fall temperatures reducing mosquito activity, State Health Commissioner James McDonald emphasizes that it's very low at the moment. But what about the future? Chikungunya originates mostly in tropical and subtropical regions, causing symptoms that can hit hard. Think high fever, intense joint pain, which might feel like arthritis flaring up, headaches, muscle aches, joint swelling, and sometimes rashes. For most folks, it's uncomfortable but not deadly, with recovery typically happening within a week. However, vulnerable groups, such as newborns, older adults, or those managing chronic conditions like high blood pressure or diabetes, face higher risks, potentially leading to more severe complications. Picture someone with diabetes already dealing with joint issues. Adding chikungunya's pain could make things much tougher. This case stands out as the U.S. hasn't seen a locally acquired instance since 2019, though New York did report 3 travel-related cases this year, all linked to trips abroad where the virus is more common. It's a stark contrast, highlighting how travel can bridge the gap between distant outbreaks and local communities. Moreover, local mosquitoes here aren't strangers to danger. They can also transmit other viruses like West Nile, Eastern Equine Encephalitis, and Jamestown Canyon, which have caused concerns in the past. Think about how West Nile has affected communities in recent summers. It's a reminder that our backyards can host these hidden threats. Now, for the controversial angle. Some experts argue that this incident points to broader shifts, like global warming allowing mosquitoes to expand their range, potentially bringing more exotic diseases to temperate zones. Is this the start of a trend, or just a one-off event? Others might wonder if underreporting of mosquito pools or inadequate surveillance is masking bigger issues. What if stricter mosquito control measures could prevent this, but at what cost to the environment? It's food for thought, and it begs the question, are we doing enough to prepare for these changing realities? What are your thoughts on this? Do you live in an area with similar mosquito concerns? And how do you protect yourself? Is climate change amplifying these risks? Or is there another factor at play? Share your opinions or experiences in the comments. I'd love to hear differing views and start a conversation.